Welcome to this video series on wellness program resources. Our topic for this video is benefits of wellness programs, number 45. Almost all organizational life is usually pretty purposeful. We almost always do things for specific defensible reasons. As I was working with one of my clients, which was a small, innovative health plan in rural California, as their wellness consultant, I was trying to help them position a new employee wellness initiative that they were bringing on the line. As we discussed the options, I was struck with the importance of having a much more clear sense of understanding of the various potential benefits to different parties that are involved as stakeholders around the wellness issue. And to help with the discussion and with the group's decision making particularly, the VP of HR at the time was a particularly sharp individual. She had asked me to develop an overview of the potential benefits that could be associated with the new wellness initiative. She seemed to intuitively understand that the program design team, which included a number of people, would have trouble seeing the new initiative from the perspective of the various different major actors involved. So at our next group planning session, I brought the original version of the tool we are going to look at shortly. As we went through the potential benefits of a wellness program associated with area employers, the community at large, the participants themselves, and finally the health plan itself, the group seemed to gel and to understand the various issues that they needed to address in the design of their new employee wellness program. However, I did, and all honesty, I did still need to remind them at times and remind the group at times of which benefits went with which major actors. And there's definitely seemed to reach agreement at a much faster pace than other groups that I had worked with up to that time. And they began developing their own perspective on the positioning and the emphasis of the various aspects of the new employee wellness program. I later found and developed the tool that resulted from this particular consulting engagement, and also found that it was helpful in other circumstances where there were, for instance, multiple senior executives that had very different views of the program. The tool that I ended up putting together did in fact help significantly with sorting through the issues and being able to get clarity around the positioning of the wellness program. It seemed to help senior managers decide what was important for them to consider and to emphasize when selling the program to the various other major parties that were involved. Now, at this particular juncture, we're going to go to the next slide, and you'll have a chance to download the survey tool, the tool itself, and then we can discuss it. Now, before we look at the tool itself, I'd like to go over some of the major groups who we need to think about related to the benefits and understanding the various potential benefits that are there. First of all, the employer community is obviously one of the major groups and a major group that we want to look at their perception of what things would be a benefit. And we can generally look at that through looking at the eyes of the economic issues, as well as the what's called value on investment issues, which are more HR related effects like morale or recruitment or retention. Now, that employer group has very specific issues that they're concerned about. So our identification of the benefits needs to follow some of the major issues that they're involved in, and we'll look at those in more depth in a moment. The community at large is also a major group that we want to understand from their perspective, what is that wellness program for that employer doing? and how large is the employer, and what percentage of the community is actually employed through them, and what are the benefits that they're interested in. The third group are really the participants themselves. So that's oftentimes how we're marketing the program, is understanding the benefits that accrue to that particular group. And our last group is the health plan group. Now, in this particular case, the health plan was the employer, but the health plan also functions as that health plan in terms of the kinds of benefits that it gains from, or potentially gains from, the creation and the design of wellness programs with specific kinds of benefits involved in them. The other major issues that we need to be careful about are, one, how does that benefit relate to the relevance to our goals? We would like to have prioritized goals for our wellness program, and we want the specific benefit associated with some of the major groups involved in the design of the program and related to our stated goals. Second issue is that the focus of management is also going to be necessary in order to modify the wellness program to address some of those more unusual goals or unusual benefits that we might attribute to the wellness program. The third area is that specialized interventions are usually necessary if we want to affect, for instance, workers' comp cost or disability insurance costs, or if we want to affect recruitment and retention. There are specific changes we need to make to the interventions involved if we want those benefits to actually accrue. And finally, there needs to be enough consistency and the timing of things needs to be carried out over the long haul, because some of these issues of benefits do take some lead time in order for us to achieve them or to experience them. So, in summary, there are many different potential benefits of an employee wellness program that are associated with the different major actors involved, along with some of the related practical issues that also need to be addressed in our design work. Next, let's look at the tool that came out of this original client engagement. Now, as usual, a link to this 3-page tool is provided in the description for this video. You can download it for free. I would recommend that you potentially pause this video and download it and or print the tool out right now, and then restart the video and follow along with me as I cover some of the major points. Now, this first page of the 3-page document starts with employer, and the issues that we see of value are increased worker morale. Now, you'll notice in the handout that it also includes supporting data and or documentation. So these are the sources you would go to get information about this particular issue. And if the second one is potentially greater employee loyalty. The third is improved employee resilience and decision-making quality. The fourth is a positive public and community relations. The fifth is increased worker productivity. The sixth is presenteeism loss reduction. Seventh is informed healthcare cost-conscious workforce. The eighth is a recruitment tool. The ninth is a retention tool. The 10th is the opportunity for cost savings via reduced sick leave absenteeism. The 11th is opportunity for cost savings via reduced short and long-term disability claims. The 12th is the opportunity for cost savings via decreased healthcare utilization. 13th is, the next page, is the opportunity for cost savings via reduced premature retirement. So that's where we are essentially keeping people from retiring because they are more capable and able to work. Opportunity, the 14th is opportunity for cost savings via decreased overall health benefit cost. The 15th is opportunity for cost savings via fewer on-the-job accidents and the disruption which they essentially usually create. The 16th would be the opportunity for savings related to lower casualty insurance costs. So there's liability. The liability insurance can be either an employee benefit, group benefit, or in the liability area, where you have losses which have to be essentially adjudicated or the insurance resolved. 17th is the opportunity for cost savings via reduced medical leave time. So they're reducing the amount of medical leave during the workday that people are taking. And the last is opportunity for cost savings via reduced occupational medical costs. So those are the costs that we generally encounter to reduce the other costs. But if we in fact are able to reduce the other costs, then it is likely we're going to be reducing some of the occupational medical costs. And again, on the right-hand side of the tool are the various sources of information for you to use to get data about your workforce or your particular industry. Now, the next category is the community. And the first of the benefits is to provide a model for other local organizations and areas. And some companies like to be the forerunner of new things. Contributes to establishing good health as a norm. So that's a kind of a good community, service aspect. The third item in community is it complements and reinforces national and local public health initiatives. So we've had objectives for the nation, health objectives for the nation for some time, and those are oftentimes accomplished with things that we do in a worksite wellness environment. Also improves the quality of life of citizenry, of the broader citizenry. It also helps control and possibly reduce the economic and social burden on all taxpayers from premature mortality and morbidity. So if we're doing something in our wellness program to essentially reduce the prevalence and severity of chronic diseases, then that has other ripple effects in terms of the social burden, if you will, for individuals. And the last of the community benefits is to help improve the general economic well-being of communities through the improvement in general health status and productivity. So that's more of a general kind of benefit. The next actor that we deal with is the individual participant. So from the participant's vantage point, increased morale via employers, providers, or communities' interest in their health and well-being. Secondly, increased knowledge about the relationship between lifestyle and health, which, by the way, is pretty low. Most people don't understand that they need to really stay as active as they possibly can as they age, and that's got a lot of implications for our healthcare system and for our employers. Improved health status, so that's the individual's benefit. The next one is increased opportunity to take control of their health and medical treatment. And that's more of the satisfaction of knowing that you are in control and you're not helpless and you're not just a victim of healthcare system's activities. Improved health and quality of life through reduction of risk factors. A whole series of risk factors associated with chronic disease and with injury burden. Increased opportunity for support from coworkers and environment. Next one is reduced work absences. Next one is reduced iatrogenic risk. And iatrogenic is actually Greek for physician-induced or hospital system-induced. Iatro is a physician issue in the Greek language. So it's a root for that. And it just indicates the effects of mistakes that are made in healthcare. And there are always some mistakes going on, the wrong medications, wrong dosage, wrong timing, wrong patient, wrong organ that is the focus of surgical intervention. So there are a series of iatrogenic risk. We also call that patient safety. The Leapfrog project is one of the major ones that relates to that. And reduced risk of out-of-pocket and premium cost for medical care. So particularly with plans with higher deductibles and higher maximum out-of-pockets, individual and family, you will end up seeing reductions in those. And then another benefit to the individual, potential benefit, is reduced pain and suffering from illness and accidents. So those, again, are the benefits that ascribe to the patient, or the actual participant rather, and the individual that's using the program. Now from the health plan perspective, on page 3, greater member satisfaction, increased market share through differentiation and differentiating the health plan. What the health plan in this case learned, they turned around and applied and gave to their enrollees and their members. So there was some development benefit in using the employees of the health plan as the guinea pig to actually test out different kinds of interventions and targeting. And that's what they did. More improved member retention, which is a big issue for health plans, is keeping the people that they have and having them re-up and re-enroll in their plan. More appropriate utilization by consumers and patients, and that's a big issue for us in the healthcare system. And then reduced utilization and cost through improvements in morbidity. So there's something called compression of morbidity developed by a guy named Jim Fries at Stanford. He was an endocrinologist, rheumatologist, and he articulated this idea of interventions that would in fact compress morbidity. Now morbidity is illness and injury, so that's what you're doing when you are compressing morbidity. Improved price competitiveness. So the more that we get transparency in pricing, the more that we experience that cost or have a reason to make choices that lead to lower expenditures in healthcare, the better off our system will be. And finally, improved HEDIS performance, which means that the evaluative measures used to look at healthcare, it can in fact help steer the individual to health plans that are more prevention oriented. So again, this tool is really used and can be used to help people see the potential benefit. I might add though that also means that your interventions need to follow these particular reasons, these particular benefits. So you can't just do any old kind of wellness and expect these potential benefits to be fully realized or fully created. Finally, this tool can be used as a handout for a group discussion with senior managers or with a design team. And then with a little bit of modification, it can also be used as a survey instrument to find out what potential benefits are most important to the various groups and major actors that are involved in any kind of design work. Then summarizing that information from the use of this tool as a survey will provide some excellent direction for the planning process. Finally, in summary, this week's topic is about the need to have a fairly exhaustive list of the potential benefits of an employee wellness program to the various parties and actors that are important, and to use it in gaining consensus about the targets and interventions to be offered under your employee wellness program. Thanks for watching this video, and also be sure to subscribe to my YouTube channel. New videos are published weekly. For more information, search for the WellCert program. WellCert is the premier professional certification for wellness program leaders. Be sure to check out the program if you want to improve your wellness programming skills. Again, the link to the tool is in the video description. And remember, delivering great employee wellness programming is a high calling. Let's do our best to get the job done.